Okay, so we will review about what did we talked about before about congenital malformation in the head. Generally, I just kept talking about the face. Okay, so congenital malformation, we said before, means that anomalies, birth defects, congenital disorder, or congenital malformation at the same time. Okay, we usually use these terms for the same purpose. Okay, so congenital anomalies can be defined as structural or functional anomalies or abnormalities, that is including metabolic disorder which are present at the time of the birth. Okay, we say metabolic disorders. I didn't have talked about what does it mean metabolic disorder. Usually there is a problem with the metabolic disorders like diabetes mellitus patients, or let's say a patient has not a kind of enzyme that is that participate in the metabolic. Okay, I mean in the metabolism. Sorry. So like what? Like lactase enzyme. Okay, these are all we say abnormalities, congenital abnormalities for it. Okay. So we said before that there are some causes for congenital anomalies, like what? Like genetic factors such as chromosomal abnormalities and mutation, or environmental factors like viral infection, bacterial infection, sometimes radiation. Okay, or we can say also medication. Also, some kind of medicines can affect on the fetus, and also combine genetic and environmental factors, like we call it multifactorial factors. I mean, the genetic factor and environmental factors are at the same time. Okay, so we said before we have a kind of abnormalities that happen in the tongue, which is the tongue tie case. We call it ankyloglossia. Okay, ankyloglossia. So the tongue, in this case, is not free from the floor of the mouth. Okay, and it is actually connected or anchored to the floor of the mouth by a kind of tissue. We call it frenulum. Okay, so the lack of degeneration of the incomplete degeneration of this kind of tissue lead to have the frenulum, or the frenulum will be extended to the tip of the tongue. Okay, and this will actually affect it is in levels. I mean, the severe one is incomplete or complete anchoring or connecting to the floor of the mouth. So it will affect the feeding, I mean, and also the speech of the baby in the future. And it's usually treated by medical operations. Okay, look at here. We have a lingual frenulum right here. This is the normal case. As you see, the abnormal lingual frenulum that is extended to the tip of the mouth. Sorry, the tongue. Coring of the tongue to the floor of the mouth. So I think this is clear. The facial clefts, we said before, that we have the cleft lip and we have a cleft palate. Okay, and both result in the defect of the facial appearance. So it will affect the facial the appearance of the baby, and is also will affect on the difficulty in the speech and also in the feeding also, for sure. So the incisive foramen, we will say it will be considered as dividing the landmark between the anterior and posterior clefts, because we will usually divide it to classify. Let's say classify it to the anterior clefts and posterior clefts. Okay, so look at here. We have the primary palate, incisive foramen, and secondary palate. Okay, while we have the uvula at the behind. Okay. So the anterior clefts are including lateral cleft lip, cleft upper jaw, and cleft between primary and secondary palate. Okay, cleft between primary and secondary palates. So we said that there is a reason for this kind of the clefts, and I've mentioned it before in the the development of the face also, and we said that there are prominences that are forming the part of the face after their fusion. Okay, I mean the whole prominences that are forming the parts. These parts are or prominences that will fuse in order to form the structure in the face. So if there is a lack of fusion or incomplete, or let's say partial fusion of these parts, this will lead to having the cleft. For example, if there is a cleft in the lateral if there is a cleft in the lip, we will say that the partial or incomplete lack of fusion of the maxillary prominences, or what, in one side or in both sides. Okay, so please, I will ask you, just let me explain, and I will return to ask you the questions if we see that are you with me or not. So if everyone filled the form, I will just pause it. سجلتوا حضوركم كلكم؟
لا دكتورة.
لا، شلون؟ شوف أنا عندي 57 طالب، 53 طالب. طلاب يلا بسرعة راح أسدها، استعجلوا. ورا دقائق راح أرجع أسدها بعد ما أفتحها، أوكي؟ واللي يقول لي ما سجلت حضوري، فأنا مسجلتها، أوكي؟
دكتورة عفوا،
نعم أحمد.
بس ممكن تدزيني الرابط مرة أخرى لأن أنا هسه دخلت.
طلاب مثل ما قلت لكم الفورم هو شيء احتياطي، لأن أوريدي هو الميتينج اتندنس يسجلكم دخولكم وخروجكم شو وقت دخلتوا، فمجرد احتياطا أنا داخل الفورم. أوكي، so let's continue. So we said that we have anterior clefts and we will come to the posterior cleft. So the posterior cleft will include secondary palate cleft and also cleft uvula. Okay, and the reason for this also is the lack of fusion of the palatine shelves, as we talked before, and we said in the formation of the secondary palate, whenever there is a lack of fusion between these palatine shelves that are formed from maxillary prominences, there will be a cleft between them. Okay, and there is also cleft uvula. This is actually happen due to the environmental factors, smoking, like kinds of specific kind of medicines, and also in the diabetic mellitus patients also may happen. Okay, so if you classify the clefts, we will say, look at here. We have a primary palate, secondary, and uvula. Okay, the jaw or the lip. So if the cleft is on one side, we'll say it is unilateral cleft lip. Okay, that is extending to the nose also. Also, if it is in one side, also we will say unilateral cleft lip, but this one is also, we can say this in the we say in the incisive foramen. Okay, and also including the primary palate, extending to the jaw, lip, and nose. Okay, it is bilateral cleft lip. Okay, extending to the jaw and palate. Okay, and we have also right here what we have cleft palate. Okay, in the secondary palate, this one is the cleft is extended from the palate to the primary palate, incisive foramen, jaw, with the lip to the nose. Okay, so let's see some pictures and cases in order to have a better understanding. Okay, so look, this is unilateral cleft lip. Okay, unilateral cleft lip, while this is bilateral cleft lips in each side. Okay, what about this one? Who can tell me what is kind of the clefts right here? What is the kind of the cleft in this case, or in this picture, let's say? Let me see. Who can raise his hand? محمد وليد. Yes, محمد.
دكتورة يونيلاترال يعتبر؟
صحيح unilateral. أحسنت. زين. الكليفت وين موجود؟ Where is the cleft؟
دكتورة ممتد عندنا من النصل أعتقد لحد البالت، بس يعني الأورال كافيتي ما مبين حتى نقول أكثر أو لا.
أنت أنت مجرد تشوف الأبيرنس حاليا، فشنو دا تشوف؟
الممتد عندنا من النصل لحد اللب، ولا أعتقد الجو
اللب وجو. أحسنت. باليت ما دا نشوفه، فما نقدر نحكم. أوكي، ما نقدر نحكم عن باليت، ما دا نشوف حاليا شنو الموجود، صح ولا لا؟ اللي دا نشوفه حاليا كصورة أنه lip and jaw extended to the nose. Excellent, thank you very much. Okay, let's continue. What about this case? Who can answer? Please raise your hand. Ahmed Raed.
Bilateral.
Bilateral cleft of what?
Of the nose. It's extended to the nose and the upper lip.
Tell me of what? حاليا أنت إيش تشوف؟ أول شيء بشكل رئيسي قبل النوز.
فلترم.
أكبر لك الصورة، شوفها.
The upper lip.
Upper lip, excellent. Yes, what else? It can be in the jaw also. Okay. لأن شي واضحة كأنه موجودة in jaw also, and it is extended, as you said, to the nose. Excellent. Thank you very much. Look at this case. What about this case? Who can tell me what's the kind of the cleft right here? Okay, خلينا نشوف ماذا يرفع. إسراء. Yes, إسراء. إسراء إبراهيم. نبأ.
دكتورة isolated cleft palate.
ماذا أسمع؟ عيدي.
Isolated cleft palate.
Isolated, okay. Which kind of the cleft? Not palate. شلون قلتي palate؟
بس isolated cleft.
شنو هو isolated cleft؟ أنا ما شرحتها بالطريقة، صح؟ الكليفت وين تشوفيها حاليا؟
اللب صاير والجو.
اللب والجو extended to the nose. It is unilateral or bilateral?
Unilateral.
Unilateral cleft lip, okay, is extended to the nose, and as you see, the result of the medical operation. Okay, so let's see to this figure, and we can see that. Look, as we said before, how the palatine shelf, they will fuse right here week by week till we will have the secondary palate. Okay, but if there is a lack of fusion, we will have the cleft right here. Okay, the cleft right here. So look at here. What's the kind of the cleft right here? Raise your hand, please. Yes, Marwa.
Cleft palate.
Cleft palate. Excellent. Thank you very much. What about this one? Who can tell me? Just focus, because more than one kind of cleft. Yes, Zahra.
It is like a cleft palate and unilateral anterior cleft.
Unilateral anterior cleft, including what?
A cleft palate.
Including what else? It's not just one kind of cleft.
It is cleft palate and the unilateral anterior cleft of the lip.
Of the lip, and what else? Extending to what? Well, you can see right here. It's extended to the jaw also. Okay, so we will say cleft palate extended to the, as you said anterior cleft palate, we can say generally, but you have to specify it as in the jaw and lip also. I think it's extended to the nose also. Okay, you have to mention about all the kind of the cleft right here. Thank you very much, Zahra. What about this one? Who can tell me? Let me see who's raising. Yes, Manar.
Cleft uvula.
Cleft uvula, excellent. Thank you. Thank you very much. So, thank you for everyone. And let's continue. We said that we have a kind of cleft which is called oblique facial cleft lip. Sorry, oblique facial clefts. That is a result of the failure of the maxillary prominences to merge. Okay, so as you know, the maxillary prominence forming most of the part of the face from upper part. Okay, so as you see, the failure of the merging of this part with the corresponding lateral nasal prominence will give us a kind of a cleft. So, and also the nasal lacrimal part will be usually exposed to the surface. Okay, so look at here. This one is the oblique facial cleft, and this one also the oblique facial cleft. Okay, so the last one is median cleft lip. Median cleft lip. This kind of cleft is somehow rare, and it's caused by incomplete merging of the two medial nasal prominences. Okay, incomplete merging of the two medial nasal prominences in the midline, just like this one. Look at here. This is the midline cleft lip. Okay, and also this one is midline cleft lip. Okay, so who can tell me what's the kind of the cleft right here? Just let me see who's raising. And Nurhan. Okay, who's raising hand? محمد وليد.
نعم دكتورة.
What's the kind of the cleft right here?
يعتبر عندنا unilateral ممتد من النصل واللب والجو.
Excellent. Thank you. Thank you very much. Very good. Okay, what about this one, everyone? Let me see who's raising hand. Isra. إسراء. خليني أشوف الشات خفض تجاوبون هنا لا. أوكي إسراء رافعة يدك وينك؟ أوكي منار.
Yes.
So I have asked the question and said that what is the kind of the cleft right here in this picture?
I think about the upper lip and
Yes.
maybe nose.
Okay, what else? Is it uni or bilateral?
Bilateral.
Bilateral. Cleft of what?
Cleft of upper lip and
Okay.
maybe nose.
And what else?
Nose.
Maybe jaw, okay, because it's somehow
Yes.
extended. Okay, thank you very much.
Exactly. Thank you.
Okay, thank you. Okay, who else? Who else? Nurhan? Okay, you're raising your hand. You don't answer. What's the problem with it? Okay, Nurhan. What is the kind of the cleft in this picture? Kind of the cleft?
Cleft palate.
Cleft palate. Excellent. Thank you very much. Autism, we said that we have some cases like natal teeth that is present over the teeth at the time of the birth, or it can also erupt during the first month of the age of the baby, and maybe it's abnormal in the number and shape with the size, also discolored by some kind of antibiotic or medicines like tetracycline. Also, it can be deficient in the enamel caused by deficiency of the vitamin D. And also, these all can be happened by many factors, and this will include also genetic and environmental factors. As we said, deficiency of vitamin D is what? Is it environmental or genetic? It is environmental factor. And also the medicine. Number, shape, size can be genetic factor, okay? So let's review with asking you questions. Okay. يعني أنا لو ذاكم بعد ما أرجع أقرأ قد ما دين عادلكم صح ولا لا؟ أوكي. اللي رافعين إيدهم شنو السالفة؟ عندكم سؤال؟ Do you have a question?
دكتورة ما عندنا سؤال بس شنا رافع ايدنا على أجوبة.
أوكي. مو ناسيها. أوكي. Okay, so let's review and ask some questions. Okay, so what can be the causes for congenital anomalies? What can be the causes for congenital anomalies? Yes, Hajar.
Genetic factors and environmental factors.
With what?
Genetic factors.
Environmental factors and also?
Combined genetic and environmental factors.
Very good, thank you. Very good, Hajar. What else? What we will talk about tongue tie. What do we call tongue tie in another term? What do we call the tongue tie in another term? Yes, Muhammad.
Ankylosing.
Ankylosing. Thank you. Very good. Okay, so who can tell me what's the reason for the ankyloglossia? Who can tell me the reason for ankyloglossia? Yes, Aya. Aya Falah, yes.
دكتورة ممكن تعيدين السؤال؟
السؤال, what's the reason of tongue tie? The cause of the tongue tie or ankyloglossia. شنو اللي يسببها أو شنو هو؟ شلون دا يصير؟ Or let's say in another way, how tongue tie happen. Okay. Yes, Ahang.
It's because of the frenulum that is anchored from the floor of the mouth to the tip of the lip.
Okay, yes, exactly. Thank you very much. What's the kind of the tissue that will anchor the tongue to the floor of the mouth? What is the kind of the tissue that anchor the mouth, the tongue to the floor of the mouth? نفس الأشخاص. رانيا.
Tongue not free from of the floor of the mouth.
رانيا فهمتي السؤال؟
دكتور ممكن تعيدي؟
السؤال هو what's the type of the tissue, or what do we call the tissue that anchor the tongue to the floor of the mouth? What do we call the tissue? What's the name?
Extensive cell.
No.
Frenulum?
No, we call it frenulum. Yes.
Yes.
Thank you. Very good. Okay, good. What else? Let me see. Okay. So what do we call this case, or diagnose this case? Who can diagnose this case? Yes, Mariam.
Tongue tie.
Mariam?
Tongue tie.
Tongue tie, or what do we call it in another term? Medically, or the medical term, what do we call the tongue tie case?
Ankyloglossia.
Yes, thank you very much. Okay, so let's come to the facial clefts. What's the result of the cleft lip and palate, or what's the effects of the cleft lip and the palate? Yes, Ahmed Raed.
Result in the facial appearance and difficult in the speech.
Right. Can it affect on the feeding?
What?
Can it affect the feeding? Feeding. Can this affect the feeding in your opinion? يأثر التغذية؟
Yes.
رأيك? Yes, it can sometimes. It's according to the case. Okay, it's according to the case. Okay, thank you very much, Ahmed. Let's see what else. Okay, what are the anterior cleft lip? Count the anterior cleft lip. The kind or the types of the anterior cleft lip. نور منعم.
Lateral cleft lip, cleft upper jaw, cleft between primary and secondary pelvis.
Good, thank you. Thank you. What about the reason of the anterior cleft lip? Not the lip, as usually. What's the reason for the anterior clefts? Muhammad Yusuf.
It's due to a partial or complete lack of fusion of the maxillary prominences on one or both sides.
Yes, thank you. Who can else repeat? Malak? The reason for the anterior cleft lip?
Doctor.
Yes. The reason
due
for
to the
partial
or complete lack of fusion of the maxillary prominence or one of the or both sides.
Yes, thank you. Good. Let's see what else. What do we have for the posterior? So what are the clefts that happen in the posterior part or posterior clefts? علا.
نعم دكتورة. cleft sensory العفو secondary palate, cleft uvula, oblique facial clefts ومedian cleft lip.
Yes. Oblique cleft lip and what did you say? Median. These two are not posterior. Okay, they're not
sorry, yes,
considered
median.
posterior.
Sorry, three types. Just
two type. Two. Yes. Okay. Cleft of the secondary فهو posterior يعني الموجود بالجزء الposterior. So cleft secondary palate and cleft uvula. So what's thank you, Ola. What about the reason for the secondary cleft palate? Secondary cleft palate or secondary palate cleft. Sorry, was raising the hand. نورهان you answered I think ونفس الأشخاص اللي يجاوبون. خلوني أختار بشكل عشوائي. أسعد نهاد. Yes, أسعد. أسعد, what's the reason of the secondary cleft lip? Sorry, secondary palate cleft.
Was cleft uvula?
What is the reason for the cleft of the secondary palate?
Okay, environmental factor and smoking creating.
No, this is for uvula. I'm asking you of the secondary palate. If there is a cleft in the secondary palate, so what's the reason for it?
Lack of fusion of the palate shell.
Yes, thank you. Lack of fusion of palatine shell.
Yes.
Good, thank you very much. Okay, what is the factors that affect the cleft uvula, or the reason for the cleft uvula? Sarab? Yes, Sarab. Okay. عسل. عسل أنا ما علي اسمك جذبني. عسل وينك؟ So you left. Okay. Let's see who's raising hand. Ita.
Environmental factors, smoking, certain medication, and DM.
Okay, thank you. Good. Okay, let's see what else. What is the kind of the cleft in the picture? What is the kind of the cleft that is shown in this picture? Let me see. Ahmed Nisan. Yes, Ahmed Nisan. اللي رافعين ايدهم كلهم شاركوا. They have participated, so they won't participate more. Bina?
دكتورة unilateral.
Unilateral cleft of what?
Jaw and upper lip.
You can't see the jaw. How you can see it's in the jaw?
No, it's just from the upper lip.
Yes, thank you. Because we couldn't see if there is an extension to the jaw or not. Okay. Is it extended to the nose?
Yes.
Yes. Are you sure?
Oh, wait a minute. It's not so clear, the picture, I mean.
Okay, let me...
No.
Look.
No.
No. Okay, so it's not extended to the nose.
Yes.
Thank you.
You're welcome.
Okay, let me see. What about this one? Let me see who's raising hand. محمد علاء.
نعم دكتورة.
Yes.
Bilateral cleft upper lip nose.
Yes. Extended to the
Yeah.
nose. We don't know if it is if it's extended to the jaw because we can see actually by our eyes. But I think it is extended to the jaw, isn't it? Maybe. Okay, thank you very much. What about this one? خلوني اختار عشوائي. داني فؤاد. داني ما تجاوب. اوكي خلينا نشوف بعد مين اكو هنا. علي عيسى. يا إما ما موجودين عارفين الموبايل ورايحين أو أنتم ما تدرون تجاوبون. لارا عبد القادر.
طلع نعم.
Yes, Lara. What can you see? What's the kind of the cleft?
Unilateral cleft.
Yes, unilateral cleft of what?
Of the lip.
Of the lip. And what else?
And the jaw.
Jaw. And is there any extension to the nose?
Extension, yes.
Yes, there is. Okay, good. Thank you.
Thank you.
Thanks. Okay. What about this one? Who can tell me what's the kind of the cleft? لحظة خلوني أشوف. محمد واحد الدين.
دكتور unilateral يعني bilateral.
bilateral أحسنت. bilateral what؟ كمل لي إياها. bilateral شنو؟
lip extend to nose.
Yes, bilateral cleft lip extended to the nose. Thank you. Thank you very much. Okay, just 1 minute. Okay. Less than 10 minutes. Okay. What about this one? Let me see. Who's there? محمد عبد السلام.
Yes, دكتورة.
Yes, محمد عبد السلام. شو تشوفه بهالصورة? What's the kind of the cleft?
Unilateral.
Unilateral. كمل لي إياها. Unilateral cleft إيش؟
Lip, upper lip.
Yes, what else?
There is
any
extension to the nose. Yes.
Excellent. Thank you very much. Thank you. Thank you, Muhammad. Let me see. Muhammad Yusuf. Muhammad Yusuf.
Yeah, yes.
Yes, Muhammad Yusuf. Let me see. Just wait. What's the kind of the cleft right here?
Palatine cleft.
Palatine clefts. Thank you very much. Okay. Let me choose someone else randomly. Mustafa Mazen. هدى محمد.
نعم دكتورة.
Huda. Huda, what's the kind of the cleft in this picture?
A unilateral cleft of upper lip extending to the nose also.
Yes, what else? What else?
Also upper jaw and the palatine.
Palatine, yes. Including secondary and primary palate cleft. Okay?
Yes.
Yes, thank you. Very good. Thank you very much. Okay. What's the kind of the cleft right here? Let me see who's raising the hand. Okay, wait. Yusuf? Yes,
نعم
Yusuf?
دكتور. Uvula cleft.
Uvula cleft. Thank you very much. Okay, what is the reason for the oblique facial clefts? What causes the oblique facial clefts? Marwa?
دكتورة.
Yes, answer. Can you answer me?
The reason, yes, the reason is failure of the maxillary prominence.
Failure of the what?
Maxillary prominence.
Failure of what? What will fail?
Doctor, oblique fish.
Yes, you need to say what's the fifth.
Oblique facial cleft is
Yes.
the reason because of failure of maxillary prominence to merge with lateral nasal prominence and
Yes.
nasolacrimal.
No, not as nasal lacrimal. Just saying that nasal lacrimal will be exposed to the surface. Okay, thank you. So what's the reason for the median cleft lip? Someone else? Yes, Nurhan? نور صباح.
نعم دكتورة.
نورهان بعدين. نور صباح ما مشارك اليوم. شكرا. Okay, thank you.
نعم دكتورة.
Yes, Nur Sabah. What's the reason or what's the cause of the median cleft lip?
Two medial nasal prominence in the midline.
What is two median nasal?
In the complete merging.
Okay, incomplete merging of the two medial nasal prominence in the midline. Okay, thank you, Noor. Okay, so let's see some. I said it here. So just I'll ask about this one. What's the kind of the cleft right here? The kind of the cleft in this picture?
Median.
Who's talking?
Ma'ab.
Ma'ab, yes, Ma'ab. Median cleft lip. Thank you, Ma'ab. What about this one? اللي ما مشارك ممكن يحكي.
Oblique facial.
Oblique facial cleft lip. Who are talking? Who's talking? Yes, Isra. Thank you. Thank you very much. So this one also is median cleft lip, and we said that the tooth abnormalities, there are many abnormalities. So what's the case of this one? What happened to this teeth? Malak? This one? What do we call this case?
Yes, doctor.
Yes, what do we call this case? Be
Tooth
quick.
tapping?
No. Thank you. Yes, Manar.
It's tooth abnormalities.
Yes, tooth abnormality. What do we call the case? Discolored teeth. Okay. So, Ahmed Raed, tell me about this case. What do we call it?
Empty tie.
No, not tongue tie.
Metal teeth.
Natal teeth. Thank you very much. Okay, Tolab, thank you very much for today. Thanks for your attendance. See you next week. If you have a question, you may ask. If you don't have, feel free to leave the meet. Yes, Ahmed.
دكتورة عفوا هسه نزلوا تبليغ انه الاسبوع الاخر من الاسبوع الاخر تبدا الامتحانات العمليه اعتقد.
ايه
احنا راح نتوقف.
هو اذا اكيد تبدا الامتحانات راح نتوقف ان شاء الله. اذا تبدا الامتحانات كلها داخله.
تمام.
قد ما سالته كلها داخلها. لا مو كلها هي، راح اعطيكم خبر هسه، بس خلوني اشوف الملازم زين ادز الاحمد ان شاء الله ونعطيكم خبر. اوكي
تمام دكتورة.
تمام ان شاء الله. يس اسراء. Okay, see you next week ان شاء الله.